Polycystic ovarian syndrome, or PCOS. My name is Emma, and I'm in a group with Lexi and David. So what is it? PCOS is an endocrine disorder that can cause enlarged ovaries with cysts and increased androgen levels in women. Androgen levels are the male hormones. Women with PCOS have infrequent or long menstrual cycles with lack of proper ovulation. PCOS is one of the most common endocrine disorders in women. It affects up to 1 in 10 women of childbearing age, and it is estimated that 7 in 10 women of those women go undiagnosed. So, symptoms: irregular ovarian cycle. Some women with PCOS have missed or very irregular periods due to lack of proper ovulation. Many women have 8 or few periods a year, or it comes more often than 21 days. You can even stop menstruating completely or have fewer than 3 periods a year. Hirsutism is the abnormal growth of hair in male-like patterns. So it's common for women to grow hair in their face, their back, and their chest. And this is because of increased testosterone levels. Acne is very common to have acne, jawline and face, also your chest and back. And then thinning hair, which is kind of the opposite of hirsutism, but this is due to also hormonal issues. This is usually later stages, later age. Weight gain due to the improper hormone balances. Darkened skin. This is common under the breasts, in the neck, and in the groin area. Polycystic ovaries or large ovaries. So polycystic ovaries, so often in normal ovulation, women have up to a few follicles before ovulation, and these are the eggs that are getting developed to ovulate. Except with women with PCOS, they have many follicles that do not ovulate completely, so they don't have any eggs released, and it causes large ovaries and polycystic ovaries. Also, painful or heavy periods because of the lack of ovulation. The endometrial lining builds up over time, so when you do get a period, they're often very painful and very heavy. So causes, excess insulin. Insulin is what allows your body to process sugar. In PCOS, insulin resistance is very common. This can cause an increase in blood sugar levels, which causes your body to produce even more insulin. An excess of insulin can increase androgen levels, which causes the lack of ovulation and the male pattern symptoms we talked about previously. Low-grade inflammation is the term used to describe how white blood cells fight infection. Women with PCOS have a type of low-grade inflammation that causes the body to produce androgens and can lead to heart and heart vessel problems. So hereditary: if your mom, aunt, grandma has PCOS, you are much more likely to have it as well. And excess androgens. Your ovaries are producing a higher level of androgens, which causes the acne, hirsutism, and the lack of ovulation. So diagnosis. There's no definitive test to diagnose PCOS. To be diagnosed, you need 2 of the following: irregular menstrual cycles, high androgen levels, and polycystic ovaries or enlarged ovaries. Your doctor may recommend a pelvic ultrasound, which can determine if your ovaries have cysts and if they are large. Blood work to test androgen levels, blood sugar levels. You're going to test lipid panels, do LH screenings and prolactin levels as well, and they're going to want to monitor your blood sugar. Pelvic exam, so this is when your doctor feels physically for your ovaries and see if they can feel any cysts or enlargements. So complications, many complications can arise from PCOS if it's not treated. Infertility is one of the most common ones. 70% of the women that come into the doctor with infertility problems actually have PCOS. Complications in pregnancy are also very common, so gestational diabetes or pregnancy-related hypertension. Miscarriage or premature birth. In PCOS, miscarriage rates are about 30 to 50%, as opposed to the normal miscarriage rate of about 10 to 20%. Non-alcoholic steatohepatitis hepatitis is a non-alcoholic inflammation of the liver caused by fat accumulation. Metabolic syndrome is a combination of high blood pressure, high blood sugar, or abnormal cholesterol and triglyceride levels. This increases the risk of cardiovascular disease that is already there with PCOS. Obesity, and that's also because of the insulin resistance. Type 2 diabetes and prediabetes, which again is because of the insulin resistance and your body doesn't know how to process sugar quite well. Sleep apnea, which is characterized by snoring, and you get periods of breathing, or periods where you don't breathe when you're sleeping. Depression, anxiety, and eating disorders, abnormal uterine bleeding, and endometrial cancer. Endometrial cancer is a risk because of insufficient turnover in the endometrial lining, allowing cells to grow larger than normal and then become cancerous. So treatments, biggest treatment is a lifestyle change. So you're going to need to be starting to eat healthy, you're going to start avoiding sugar and avoiding carbs, you're going to need to exercise. If you can lose up to 5 to 10% of your body weight, the symptoms such as lack of ovulation, any other symptoms you're experiencing tend to subside or get better. Birth control is also a good option. So birth control containing estrogen and progesterone help decrease androgen levels. Birth control can reduce many symptoms such as irregular cycles, acne, hirsutism, abnormal bleeding, and it can reduce the risk of endometrial cancer, which is something we really want, and we want to completely reduce that risk. So we're going to prescribe you a medication to allow you to shed your endometrial lining at least every 3 months. So medications to help fertility. When you're ready to have babies, there are many medications that can help you, including Clomid, letrozole, metformin, which can also help with insulin resistance, gonadotropins, IUI, and IVF. So that's just forcing the egg and the sperm to come together, and we're implanted ourselves. So medications to prevent hair growth, if this is something that bothers you and you want a medication for it, spironolactone has really good effects. Electrolysis, which is a needle that goes into the hair follicle and then it produces a light that damages the follicle. You might need several treatments of that. And then supplements such as vitamin D, vitamin B12, myo-D-inositol, and D-chiro, and magnesium can help regulate your symptoms. So follow-up and prognosis. Unfortunately, there is no cure for PCOS, but by living a healthy lifestyle and using the treatment your doctor prescribes, you can greatly reduce symptoms. Your doctor will continue to monitor blood glucose levels to avoid diabetes and prediabetes. They will monitor your cholesterol levels, blood pressure, weight, and any new symptoms you are having to form a new treatment plan. So sources, the Mayo Clinic is a great source for PCOS. If you have any questions, you can talk to me as well.